Hello, I'm Shane Schulz, and you're listening to the WEGO Health Podcast. WEGO Health is a network of over 100,000 patient advocates, influencers, and experts helping others and transforming healthcare. The following interview is from the WEGO Health Awards Winner Series.
Hi, Julie. It's great to have you here today.
Hey, Shane. Really happy to be here.
It is really awesome to have you here. Listen, we have a fantastic interview. His name is Aaron Blocker. Why don't you tell me a little bit about him?
Sure. So Aaron Blocker is our WEGO Health winner for Best in Show Facebook. And, there are a lot of great support groups on Facebook, support pages. So this was definitely a hard category to judge because, again, we really are looking at the best content. And Aaron definitely stood above a lot of the other pages. So Aaron has Crohn's avascular necrosis, and he started his Facebook page after being diagnosed. And, like so many other patients, he felt alone, not really sure how to navigate this new diagnosis. 6 years later, his community has grown tremendously. I mean, he uses his Facebook page to educate patients, to help other patients, and really to spread awareness. What I love about the different patient leaders that we work with at WEGO Health is that maybe they start with a Facebook page, maybe they start with a blog or just a few tweets to get their message out there, but then they truly start to embody their work. And Aaron is a great example of that, where he is taking this and moving it into his career. And he is a grad student working on his master's in biology research. And he hopes to pursue a PhD in immunology so he can complete his own IBD research and help others. I mean, how cool is that? Aaron holds a seat on our patient leader advisory board for WEGO Health. And he's really, I feel like he's an asset to the WEGO Health team too. So he truly has a great heart and is motivated beyond belief to help his community. So let's get to his interview.
Hey, I'm excited to listen to this one. Let's go.
Yeah.
Well, welcome, Aaron Blocker. And Aaron, where are you from and who do you represent?
I am from supportibd.com.
Excellent.
Representing those people.
And he's got a cool way of doing it, too. Why don't you tell us, how do you go about getting the interest of your community for what it is that you do? What are some of the things that you go about doing?
So my main medium in the area that I get the word out and information out to my community is I run a Facebook page for the Crohn's and colitis community. We have over 23,000 members just on Facebook, so that's the largest avenue where I try to get information out. I use multiple different things, blog posts, pictures, trying to answer questions from people that come through. So Facebook is really my biggest avenue, and then I just disseminate my information through there.
Yeah, that's pretty cool that you have 23 members like that. That's good. Oh, no, you said 23,000?
1,000, yes.
Okay, so how long have you been doing this for?
I started the Facebook page after I was diagnosed with Crohn's disease back in 2010.
So 2010, so that's 6 years, and you've got 23,000 followers.
That's correct.
Wow. That is pretty amazing. Now, you mentioned IBD, so why don't you tell us a little bit about your story and how it is that you came about representing for IBD?
Well, I was diagnosed with inflammatory bowel disease, so Crohn's disease, back in 2009. I was 17 years old and didn't know hardly anybody with the disease. I also didn't know much about the disease itself. Around that time, Facebook pages were just getting big, so I just decided to start one to try to meet people and figure out how to navigate the disease, and then it's just turned into so much more than I ever could have expected it to be. And it's really what catapulted me into, patient advocacy and helping others.
So what got you started? I mean, I know that you had your own situation. So how did you become interested in helping others?
Well, I have a really outgoing personality, and I just love talking to people. But I also just started college at the time. I was pre-med at the time. I really have always enjoyed talking to others and getting to know them. That's really where my interest fell in. And then now it's just so much more, like I said, than it could ever been. And I just sorely enjoy helping others and talking to them and getting to know people in the IBD community, especially those who are just almost like I was and don't really know much about the disease. Kind of how my situation was. I didn't know much about the disease. I didn't know anybody with it. So the goal was to bring people together to kind of help navigate the newly diagnosed patient, getting them to meet people.
So you took that all on your shoulders, and now you've got 23,000 followers. So you must be doing something right.
I guess so. It's very humbling. I don't really like to throw the number around.
Well, I got to tell you, I own a radio network here, speaking of the Heart Radio Network, and just a shameless plug there. I'm nowhere near 23,000 followers, so how do you go about doing it? I mean, what are you doing? Different type of posts? Have you found any particular post that, actually gets the attention of the ones that are following you? Or is it just a matter of hard work over time?
It's a bit of both. You kind of learn, when you first started the page, I had no idea what people were going to like, what was really going to spark their interest. Most of it comes from people just wanting to meet people. So they get on Facebook now because social media is so huge. Get on there and type in Crohn's disease, and my page is one of the ones that come up. But they respond really well to like photos and specific blog posts. I try to post a lot of either inspiring like quotes and photos, once or twice a week to help encourage people, and then also posting specific facts about inflammatory bowel disease. And people respond really, really well to that. And they also respond well if they see that I'm actively on the page, communicating with them, getting in there and answering questions, and really just, word of mouth. They get in, they share the picture, they come in and ask questions, and they say that, we have friends who also had this, so they just point them to our page. So it's really just kind of navigating it, hard work, and try to figure out what the community likes and what they need.
All right. So you've got 23,000 followers. I just can't get over that. That's just amazing. So as far as your content's concerned, the majority, is it IBD related, or do you have a certain way of going about the different type of content that you put onto your site, or is it something that whatever comes into your mind at the time, or you find something and then you share it?
The idea is to, first of all, help educate patients or people affected by the disease. So I'll actively write blog posts about that. But I also have a background in biomedical research. So over the last year, I've kind of used that to people in the IBD community responded really well to research-based information. But a lot of people have a hard time navigating the research because of all of the big words, and they don't know, whether it's true or not. So I've really tried to use my background over the last year to navigate that for them and write blog posts talking about research, breaking it down for them. So that's kind of where the goal is heading. Outside of providing support, one of the goals is to help disseminate that research information, and they've responded really well, and they've really, really enjoyed it. So that's kind of one of the next big things that I'm working on towards content.
Do you think that your followers are looking at you as an expert with your experience like that?
Yes, I do. In some respect, it's hard for me to consider myself an expert. I've always been that way. But in some respect, yeah, I get questions all the time about specific things about IBD, whether it's research related or navigating healthcare. So I think that they do to an extent.
All right. Well, you've got only 23,000 followers, so obviously you're not getting too many. So where can people find you in order to be able to add to that list?
My Facebook webpage is facebook.com/support-IBD, and the page name is Support Crohn's Disease and Ulcerative Colitis.
And is that what you do? Is you just mainly do Facebook, or do you do other?
I have Twitter at Aaron Blocker IBD, and then I actually have a website, supportibd.com.
All right. Awesome. Well, I got to tell you, you are definitely doing it. You're doing a lot of awareness for IBD. You're doing a lot of awareness for colitis and other issues that people are having. And you're obviously getting the word out because you don't end up with 23,000 followers that easy. So you are pretty amazing. And I want to wish you good luck winning the award for the Facebook award for WEGO Health.
Thank you so much. I enjoyed being here.
To learn more and to join the WEGO Health Network, visit www.wegohealth.com. That's www.wegohealth.com.